So how do we look at the face, and how do we interpret this facial function right here? At first glance, to the uninstructed eye, it looks like they have the same thing, right? You look at their face, a quick look, the angle of the mouth is down. In both cases, it looks like a facial droop. And yet there's a very different quality about it. So let's look closer. So on this gentleman, we can see that there's a flaccid paralysis. The eye is a giveaway here, right? So we've got quite a ptosis here of the lower eyelid, but we have no bulking in the cheek at all. And if we look at the lady, we see that she has a very very tight cheek, and so tight, in fact, that it's actually shiny. And then there's a sort of a strange pattern going around the brow, where the affected brow is actually higher than the unaffected brow, as opposed to the gentleman whose affected brow is lower than the unaffected brow. Let's look further. If we look even closer, we can see that we've got this droop here at the angle of the mouth and this jowling occurring here. And in the woman, we can see these very tight cords of the platysma muscle. So we've got platysmal banding that is pulling down and depressing the angle of the mouth. And that looks like this. So we have opposite situations here. We have a flaccid paralysis versus a synkinesis. They look at face glance, they look like they're the same thing. So the interpretation of what's going on with the patient is incredibly important to providing the right kind of therapy for these patients, because really they need opposite things, right? The gentleman needs stronger muscles, and the woman needs better coordination and a decrease of synkinesis. And